What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. So what do nurses and airline passengers have in common? Or better yet, what does a good nurse have in common with an airline passenger? Or, maybe not good nurse, but how about a smart nurse? What does a smart nurse have in common with an airline passenger? Survivability. Both of them want and need to survive. Here's the thing though. As a nurse, for some reason, we have forgotten the golden rule that every airline passenger is reminded of every time they take a trip. For some reason, we nurses put everyone before ourselves. That's not just our patients, every single person, whether it's our coworkers, our family, our friends, the patients, their family and friends, their visitors, our co-workers' patients, everybody comes before we do. Which is what leads to burnout. Here's where all of the airline passengers have figured out the secret to survival. Anyone that has ever taken an airplane ride has taken a trip in a winged machine. For anyone that has been a passenger, you get in, everyone piles in. There's one thing that happens every single time that you are in a large airplane. The pre-flight checklist. Every single time that you take a flight, what's the one thing that they talk about? In an emergency, if the cabin pressure is to become unstable and the oxygen masks will deploy from the above bulkhead, what do they tell everybody? Put on your own mask first. Yet, for some reason, we don't do that. I don't know about you, but if a plane was going down and I had my wife or a loved one sitting next to me and the masks were to be deployed, I most likely would probably put their mask on first and then mine. Which is the wrong thing to do. Think about it. If it's a true emergency, you're not going to have time to put on two masks. You're going to have time to put on one mask. That first mask should be yours because you're not going to do a very good job at helping your loved one when you have no oxygen to your brain. I don't know about you, but I can't hold my breath the way I used to. While I know that we think we are superheroes, we all need oxygen to function appropriately. And if I don't have oxygen, I'm probably going to pass out and eventually die. And in both those scenarios, I'm not much use to my wife that's sitting next to me. The point of this is to make sure that you're taking care of yourself before you're taking care of others. I've said it once before, I'll continue to say it, I'll probably remind you of it again in 6 months. Put on your own mask first. Take care of yourself first before you take care of others. It is probably the secret sauce on how to prevent burnout. This has been a public service announcement to all nurses out there. Can't wait to hear your thoughts on this one. Leave your comment down below. Do you put your own mask on first? And if not, it's time to change. Always want to hear from you. Your comments are my caffeine. Share this with somebody. And as always, check your own pulse first.